Mr. Moolenaar, who also is the chairman of the bipartisan China Task Force. So thanks for being here, sir. You're recognized.
Thank you, Mr. Chairman. Thank you to our witnesses today. And, Ambassador Dybul, I want to follow up with you on some of the comments you've made about, China's work in Africa. We know about the Chinese Belt and Road Initiative. They also have the Health Silk Road. It seems that their purpose is really to expand their influence and control and expand the reach of their surveillance state and use it for both, economic as well as military purposes. I wonder if you could talk a little bit about some of the efforts they're making in Africa, because I agree with you. I think the question I hear from ambassadors from African countries is, we'd rather do business with the United States, but where is the United States? And I think it's important that we have a strategy on that, but I wonder if you could comment on that situation.
Yes, thank you very much, and thank you for the work your committee does, because I think it's hugely important. I was talking with Marion Chris Smith, of course, a part of that committee as well, and I hope the Senate does one as well. So China is all over Africa, and I can tell you they have gone in and started to meet with governments to say, well, the U.S. is pulling out here, so what can we do to support you? And that is a massive risk to us for the long term. The diplomatic dividend to us of PEPFAR has been enormous because they see their lives saved. And this is down to the community level. I go back to that person in Axum. PEPFAR means the American people care about us. Shocking state. Down to villages. If we lose that, we lose a great deal, and we lose a great deal for the future because of the mineral wealth that is there, which are essential for all the things that we're doing, as you know better than I do. But we also lose the military capacity there, and the Department of Defense has been a key part of PEPFAR. We forget about that, but in the beginning, the Department of Defense was as important as any other agency because the militaries were so devastated by HIV. We spent a lot of our time supporting the militaries, and if it comes back, they're going to be the most impacted as well. But related to China, they also have grown their pharmaceutical industry. That was actually just for China. They now are trying to export their pharmaceuticals. They're pretty good at copying pharmaceuticals, and they're even inventing their own. They're going ahead on AI, which is a massive area for the United States, as you know as well. Who's going to win the AI war? Well, first of all, you have a lot of the materials in Africa that you need to make those chips for AI, but then you also have to have places to do AI and have a genetic pool, which Africa has a massive genetic pool that is untapped. So on every level, we are at risk of ceding ground to China. Now, is PEPFAR and the Global Fund enough? No. But there are other parts of our government that could be, and here's where the planning for sustainability is so important. The planning for sustainability should not just be around HIV, TB, and malaria. That is hugely important because that will protect a lot of lives, it'll protect the future, it won't squander, as the ranking member said, our investments to date. But it has to involve a broader picture, which includes our private sector, which includes our military, which includes everything. And we can do that if we integrate how we operate.
And I would just like to also mention, when I read PEPFAR, President's Emergency Plan for AIDS Relief, I think of a plan for an emergency being something that needs to be modified, updated. And as you point out, looking at how some countries can transition. You mentioned South Africa. I'm sure there's other countries in that mix, but I don't know how often that plan is updated according to, new conditions on the ground, new situations, because it appears like it's an ongoing government program, but that's very different than a plan that is strategic, updated regularly, and as you point out, benchmarks and evaluation. But I wonder if you could, is that something that can be redrafted in a new era?
Yes, and that's exactly what needs to be done, no question about it. That the transition needs to be we have done it in some places. As I mentioned, 59% of all HIV funding now comes from domestic sources, and that's really increased over time. But it's nowhere near enough, and but we don't have clear plans, and that's what I think this committee and the administration can require. And PEPFAR actually has been working on one, but it has to be with the Global Fund because we also have sources there. But we do need to shift to a clear plan with compacts with every country, and there are some that I mentioned. There are about 3 dozen that could transition in the next couple of years, literally the next couple of years. So you could see what we need to do in that reduction in our investment. That 100 billion could go to something very low. But if you do it in a structured, clear way with those benchmarks, and you ask for that plan, and the administration demand that plan and report to you regularly on that plan, it can be done, and we can have a success. So instead of a rapid retreat that will be a total failure for us on every front and threaten our national security, we can actually turn it to a success and have that transition.
30 seconds more. Just one, I have to leave for another meeting, but one thing that strikes me is the public health community has lost trust over the years. And one of the reasons I think, you know, this issue of PEPFAR, this issue of abortion is so impactful, and I've heard it today, this term abortion care. When someone says that as a healthcare professional, it immediately diminishes their credibility in the minds of many Americans. Because when they hear something like that, they're interpreting it in a way that says, you're concerned about children dying of AIDS. Many others are concerned about children dying from abortion. And there's no difference in terms of saving an innocent human life. And so I would just say, as you speak to the PEPFAR community, to be very clear about the importance of that, because you know, all of us should be in the business of wanting to save human lives. And I think in the public health community, when terms are used like abortion care, it really diminishes the credibility. So with that, thank you. Thank you, Mr. Chairman.